Hi everyone, good to be with you. Thanks to Della and Mel and Suzanne. It feels quite strange. I don't think I've been in a room full of people for obviously a good few years now. So really delighted to be here with you today and be able to talk to you. It's great to come in and see all those conversations. So it's like a great morning and really pleased to be able to be with you this afternoon. Della said, I'm Victoria Apparicio. I work for Health Education England. I originally went there on a secondment as a clinical fellow. I'm still there on a secondment in a allied health profession workforce lead role, but my background is as a speech language speech language therapist clinically for a long time, and then went on to do some ops management, and then started to work as a family service manager, working with some of our community teams, which included audiology, although not one of our AHP professions under the umbrella. That's kind of what led me to wanting to work with other clinical groups and services. I really enjoyed sort of that experience of opening my eyes and working with other professions. So I've been with Health Education England for about 18 months now. And I've come to talk to you about regional priorities. I'm kind of assuming, I don't mind at all if you say, so I'm kind of assuming you know Health Education England, because I'm here, but I want to, just be totally honest. Before I did this role, I did not know a lot about Health Education England at all. So please do ask if there's anything you're not sure, because I'm really keen for you to understand the work that is there. Long arm body, the focus is very much on education, training and supply of the workforce. So here we go, we're working. So national drivers around Health Education England for the workforce. So very much focused on the NHS People Plan to meet the demands of the People Plan when it was first published over the next 10 years. We're now saying right up to 2024, which amazingly is not that far away at all. But his role, the Health Education role, is to ensure an effective supply of AHPs, ensuring robust deployment and development of staff, placing a focus on retention of staff across professions and geography, ensuring the right workforce with the right skills in the right place to deliver high quality care. So what we're going to do in the slides is we're going to take these three key areas of focus. We've got future supply, bridging the gap and enable growth and delivery. And then I will talk you through what we're doing in Health Education England to focus on those areas and our ambitions within them. And I will talk about what we're doing regionally in the Midlands as well to develop and focus on those areas. So start off with our future supply. So as we've just seen with the long-term plan statement, real big focus on increasing our capacity, clinical placement expansion, which I'm sure you've all been involved in clinical placements, and also stimulating demand, making AHP the career of choice, and very much thinking about increasing our pre-registration diversity and that widening participation piece. So we'll start by looking at clinical placements. So I don't know how many of you were involved in some of the CPEC, the clinical placement expansion projects that happened a lot last year. Had some fantastic growth in placements that came from those projects that were funded. Obviously now the challenge is to keep continuing that placement piece, and we've had some challenges around placements, to be honest with you, a bit more in the West Midlands than the East Midlands, but specifically around physiotherapy placements. As you'll know, it's a super popular course, and it's a popular course for training providers to put on, and to the point that it then becomes very challenging around placements. I don't know, did anybody come to the physiotherapy summit that we had? Was anybody involved in that? Sally, you were? So in a part of response to that, we put on Health Education and we put on a physiotherapy summit to look at the challenges around physiotherapy placements, and to have 3 workshops, one with our employers, one with our training providers, and one with our students, to look at how we could do that. And it culminated in a summit, and we're very much then looking at alternative models of allocation and that piece around fair share allocation of placement. So I'm sure lots of you, many of you in the room, have students to us in Health Education England. It's absolutely fantastic, but it's obviously very challenging around providing those placements and looking at those models. So very much looking at that across the region. We had our physio summit, and the idea very much is to start to roll that out with some of our other professions, and we're planning to look at that next for occupational therapy and to support the challenges around occupational therapy placements. As part of the summit, we were discussing system level coordination of practice-based education delivery. So looking at how we can work as an ICS to meet those placement challenges, and how can we collaborate and do that together. And we've also looked at some leadership placements within Health Education England. So we had some physio and some OT students with us on placement since Easter. That's been really, really good to look at the whole piece. We talk about leadership placements, and we'll talk, I'm sure, like Bella and Suzanne, we'll encourage people to having a leadership placements, but it's really tricky to work out how you would do that. So there's a massive challenge there for us. We did that, and it was really good for us to practice what we preached. It was a really good piece of work to happen on leadership with us. And just to assure you around new programmes for AHPs, we collaborate with the HCPC to discuss new programmes that are being put into place, and to talk to the HCPC very much around placements, and if this new course comes online, where are the placements coming from, and how we're going to support our clinicians in our organisations to be able to provide placement. So, return to practice. I will hold my hand up. Before I went to work for Health Education England, I had no idea there was a return to practice programme that you could register with if you wanted to return to your profession, and there was funding available to support you in that, and there was also funding available for your organisation. And I don't know if you're aware of that at all. I worked at the time in the speech and language therapy department, and somebody rang us and said, I left the profession a number of years ago, I'm really keen to come back. Can you support me with my 30 hours to return to practice? We would, in the department, get together and decide how we did that. We didn't have a clue, but there was support for that there was a programme to sign up for, and there was funding. So we have one of our fellows in the region, Andy Potts, who some of you might know, and he leads on this for us now, and he's a great contact to have if you know people that want to return to practice, for any support for that, and then supporting them obviously when they come on placement with yourselves. It's a really good programme for return to practice. Just to let you know around targets, nationally we have a mandate to return 250 people back onto the HCPC register. So in the Midlands, we're really keen to return to our pre-COVID levels, which were around 30. And we're really keen for trusts to have an RTP champion or an RTP ambassador. So when those phone calls come in, those people don't get lost because they just didn't get to the right person. So someone picks up the phone, says, you know, really interested in coming back to work as an OT, and somebody just doesn't know who to direct them to. So it's really good to have a link person we can help to support those people and help that supply of the workforce. Okay, I'm going to ask you to be honest. Who's aware of the National Education and Training Service? Training Survey Survey. This table over here. So I wasn't either. And this is a our quality piece here. NET stands for the National Education Training Survey, and it's the only national survey open to undergraduate and postgraduate students undertaking a practice placement or a training post in healthcare. So the survey goes out. The communications for it go live today, and the survey actually goes live on the 18th of October. Stays open for 6 weeks, and really encourage students on placement to fill it in. It's the only way that we have any feedback around their experience on placement, and I'm particularly keen to emphasise it to you, because what we find is that if we ever have any concerns raised or risks, because our response is so small for AHPs, the numbers are tiny, so it won't trigger anything that we can look into and investigate more and support more and try and put those changes in place. We did a big push on it last year, clearly not so big that lots of people know about it. And we increased in the Midlands, we increased our response rate by 77%, which we all got super excited about, but our numbers were tiny. I'm really keen to, above and beyond that 77%, have another increase of 25%. So please, if you have a student on placement, say to them, as of next week, have you filled in your next survey? Please fill in your next survey. It's a way to get your voice heard about your experience, and that's the way we can make some change. And staying with the student voice theme, we have just set up in the Midlands, as a result of having students on placement, we have just set up a AHP student council for the first time at the end of September. We have got representation from 8 universities in the Midlands and 8 different AHP professions, the idea behind it is to very much hear their voice on work that is happening, and also again to develop that leadership opportunity. They will co-chair the meeting, develop the agendas, invite people in to talk. So again, if you've got students on placement, they know about the student council, and that's another development of student program. So if we look at our second key area of focus, bridging the gap for the workforce, and we'll focus very much on support workforce and apprenticeships. So support workforce piece, which I know people are aware of, I've already had a few people mention it to me since I've walked in, is a national piece that Health Education England are working on, and they've produced some really fantastic resources, and they've developed a framework, and the framework they describe very much as the vehicle to support all of the AHP support workforce work, and their aim is very much clear. This is one of the team, to have that consistent sustainable education and career development pathways for support workers. I think it's quite a tricky balance in that we've got support workers who are really keen to develop and want to find those ways that they can have those different opportunities to develop their skills and their training, and they do want to go down the qualification route. And then we have support workers who want to develop but not necessarily go down the formal ways of education. So I think the framework, the support workforce team would very much say is their guide, and to keep looking at that, reasonably to look at that and to work through that. But they also have these other 3 resources as well that will help, and I'm sure you'll have the slides afterwards, but I've put the links to any websites resources as well to have a look at here. This is the support workforce again, and this is what they're working on at the moment. And the deadline for the procurement has just closed for the apprenticeships. So level 3 for senior care support workers, and level 5 apprenticeships for assistant practitioners, and they are looking later in the year to tell us the results of the procurement for that framework, so those apprenticeships can be progressed. That's really exciting around that widening participation piece for an alternative route. Again, they're about to publish some work on public health and prevention for the AHP workforce, and again they're looking in by 2023 to have produced some resources for supervision and delegation. And they work closely with their professional bodies around commissioning the activity. So I've put the contact details here for the support workforce on. They produce lots and lots of work and resources and guidelines. It is sometimes trickier than to work out in the region and for yourselves in the organisation how that impacts you and what to do. But we've got a new fellow in the team, Seema Rugani, and part of her work is very much focusing on the support workforce. So watch this space, and Seema will communicate in the Midlands around our sort of next steps for the support workforce. And then Midlands apprenticeship expansion. We've done some previous offers as part of the cancer and diagnostic team around offering funding for radiography apprenticeships, diagnostic, and this year therapeutic as well. And we're also developing a regional HEE expansion. So I'm working closely with our faculties to do that. One of our faculties in the East Midlands has some funding to look at how we can support organisations, ICSs, to develop their approaches and streamline parts about recruitment, advertisement, and supporting apprenticeships with them. We've also got really exciting offer that's just gone out at the moment for a funding offer for apprenticeships for occupational therapists, operating department practitioners and podiatrists. So some support there to enable people to start on an apprenticeship, and also got some funding offer for bridging courses. So that links back to that support workforce as well. And I had a lot of feedback with people asking us if there could be some funding for bridging courses. So for some of our staff who wanted to progress onto apprenticeships, but they didn't meet the UCAS entry points, that bridging course can really support them. So there is an offer at the moment for some funding for AHP, for people who are involved in AHP support and want to progress onto an AHP apprenticeship. Okay, and then we'll look at our third area of focus, enabling the workforce to deliver and grow. So we think about effective deployment, and we are very much in the region at the moment looking at a regional AHP board and what that will look like, and that will be working with our AHP councils and our AHP faculties. And so we are looking at how we do that and link together across the regions. We also have the AHP network update. Is anybody in the room registered with the AHP network? Brilliant, brilliant. So the link is on here as well. It's we've got a new fellow called Rachel, and she's done a fantastic job of revamping it. So it looks really squished at the moment, and it's just gone out. And that's really great. Really encourage anybody in the room to sign up to that who's not. The link will be on the slides, and it's just a regular. It might be monthly again for a little while, but monthly or fortnightly. It's like a newsletter, but it's brilliant for opportunities that are coming in, funding opportunities, sharing of practice across the region, any updates, and then we've got nearly 1,000 AHPs signed up across the region. So there's a lot we could do with it to expand it further, but it's a great way to connect and stay in touch with what's happening. And then supporting development, I'm sure you all know about CPD funds that were available for the last 3 years. And then we have the enhanced and advanced practice offers. You might well be involved in advanced practice, but the enhanced practice is very much a new piece coming out that people are looking at that piece around those specialist skills for professions and recognising those. So watch that space for some more information on that. And then upskilling funds. So I don't know if you'll be aware or how much you'll know, there's some funding at the moment around upskilling allied health professionals to enhance advanced practice. And our faculties, so your Sally, who's here, your Nottingham faculty, will know about our elective care and our critical care upskilling. So the elective care is focused on ODPs, but our critical care upskilling is for speech therapists, OTs, physios and dietitians around upskilling. And then we also have a piece around community rehabilitation, which is for AHP nursing And so it's looking at upskilling towards advanced practice, but in this first year of funding, it's very much the foundation of career development and career opportunity. So if anyone wants to know about any more about that, quite happy to have a chat with me afterwards, and Sally might be able to tell you a bit more about some of the work that faculty does for elective and critical topics. And then if we think about retention, I'm going to take us on to look at preceptorship. I'll come back to that one in a minute. So preceptorship, Helen, who's our regional lead in the Midlands, she also leads nationally on the AHP preceptorship piece. They're looking right from the pre-preceptorship into the foundation period, and very much that's preparing for AHPs before they leave education, going into employment, and very much stepping up all the way into those enhanced roles that we talked about. And here is some of the work that they are doing at the moment. So they look at other programmes and align with the nursing preceptorship programme where appropriate, and there's some resources that have been developed. So for pre-preceptorship work, there's the e-learning for health sector work piece that's now been published. And for preceptors, there's the multi-professional training again on e-learning for health. Some of you might be aware of the workshops that happened recently around principles for preceptorship, and they're taking all the feedback from that, putting it together along with HCPC to work on those foundation preceptorship skills before they're published, and looking at an excellence framework as well. And again, the national team have put their details on there, and then that QR code take you to the HEE website. So you can scan that or you can find it. And again, we've got the links at the bottom. I'm just going to flick back to this part here, staying connected across the region. So the network we've talked about, and that's your link. But also, just to let you know that we've now got Midlands AHP live Twitter account. It's a joint account between Health Education England and NHS England, and we tweeting out on there lots again information, resources. This week that will be very busy, and we've got timetable tweets for AHP week. So if you want to join Midlands AHPs, that will keep you up to date. And we do have a website coming soon, which will be a Midlands AHP focused website, and hopefully a little bit easier to find and navigate on there. But again, lots of information that's coming up. So just go past these ones. So giving you a bit of a whistle-stop tour there of regional priorities and the work of Health Education England, what we're focusing on, what we're doing, and how you can stay connected. If you've got any questions, I'm more than happy to take those. And thank you for having me. It's been really great to be with you all today. Thank you.